Okay, so yeah, I was in a lot of pain, and also I was losing like a lot of blood, like too much blood, I guess, and instead of them giving me something for the pain, they were just more focused on stopping the bleeding, I guess, which is, I guess, now that I think about it, it's fine with me now, but then at that time I just really wish I wasn't in that much pain afterwards, so I could have enjoyed what was going on. But oh well, things happen. But I'm okay and the baby's okay, so that's really all that matters. So yeah, after that then like right after she was born, like an hour, like within the hour, they have you breastfeed her, which was really weird because, well, not weird, I just didn't know how to do it yet, so it was like weird just like putting a baby on my boob right away. But yeah, we did that, and then I got moved to a different room because you're in the delivery room and then you go into like the room you'll be in for the next like 2 days. So I got moved, and I had like getting into the wheelchair after that was like so difficult because I was still really numb. So the nurse had to like help me get up, move off the bed into the chair, and I had to have like this like giant pad. I'll talk to you about the pads that they give you in the hospital, but I had to have this giant pad in between my legs and just like holding it as I was like sitting down because like blood is just like pouring out of you. But yeah, so I got moved to my other room, and I basically just stayed in my bed for the 2 days that I was there. I didn't really get up and move much because after pushing for 2 hours, I got like the worst hemorrhoid ever, and it's gonna sound, well, not gross, but like that caused me more pain than the episiotomy and squeezing a baby out of me. Like I didn't really feel anything from my vagina like at all. It was all like my butthole. Like it hurt me so bad. Like, and then I don't know, it was just it really hurt. So that just like kept me in the bed for the whole 2 days I was there. Like the only time I got up was to get a shower, and that was on the night of the second day. I finally got up to take a shower. Sounds gross, but I just couldn't get out of bed. And yeah, so I opted to have her in the nursery at night, and they would bring her in and I would feed her, and then they would take her back. And I didn't change a diaper until I got home, which was kind of funny. My husband changed her diaper a couple times while we were there, but I didn't, because I couldn't really move enough to like get out of the bed to change her diaper. But what else? Oh yeah, I wanted to talk to you about the pads. Bring your own pads. Like, I don't care what they are, just get like the most giant pads you can get, because they'll be better than what they give you in the hospital. Because this is what they gave me in my hospital. I had like a puppy pee pad, like that like flat thing is laid, like you put on the floor for like a dog to like potty training for like a dog. They give you one of those. You put that in like either your underwear or the mesh underwear. I wore the mesh underwear because I didn't want to wear mine because I was bleeding so much. But you put that in your underwear, and then like the actual pads that they give you with the sticky stuff on it, it's just like, it looks like this. It's just like long and straight like that, and it doesn't contour to your body at all. It just like I would never use that for like if I had my period and I was like needed a pad, I would never use that for a pad, because it's like, it doesn't like fit your underwear, it doesn't fit your body. It's just like stupid. That's what they give you, and I wish I had brought my own pads, even if they were like Depends underwear. It would have been better than what the hospital gives you. So my advice is to bring your own. Yeah, I was bleeding even like after they stopped like the extra bleeding, like when I was bleeding too much right after the birth. When I was in my bed afterward, you still bleed a lot, like, and then like the nurse or whatever comes in and like presses on your stomach. I guess, I don't know what they're checking for, but they're checking for something to make sure everything's good. But they come in and they press on it, and every time they would press on it, like, I would feel like this gush of blood come out. It's so nasty, but I'm just telling you how it is. But yeah, so the bleeding and being in a lot of pain from my butthole kept me in bed pretty much the whole time. Finally took a shower the second night at like 3 in the morning. I finally decided to get up and take a shower, and it felt so good. And yeah, I guess that's about it. Trying to think if there's anything else I want to tell you, or I can think of to tell you. I'm gonna do a video on like what I used and didn't use from my hospital bag, because I pretty much used nothing from my bag. And I'll make a separate video about that. But yeah, that's pretty much it. Oh, like one of the best, now that I'm like home and like I have no time to do anything, all I think about is like I want to be back in the hospital and I want them to bring me lunch and breakfast and all my meals, because that was so nice. They would come in and they'd give you a menu and they'd be like, pick what you want to eat, and I would just like check off what I wanted for like the next day or whatever. And it was awesome because they were just like 8 o'clock in the morning I had breakfast, by like 12:31 I had lunch, I had dinner, and it was so nice just to like have meals, like someone bringing me my meals. But yeah, I guess that's really it. The episiotomy didn't hurt. I felt her cutting, like not like pain from cutting, but I knew she was cutting me, if you know what I mean. But that didn't hurt. Really had no problem with the episiotomy until a week or so after. Then I think it might have gotten infected a little bit because I was in a lot of pain from it, and I went back to the doctor and she gave me antibiotics for it, and now it's better again. If anyone has any questions or anything about episiotomies, you can ask me. Yeah, I think that's it. Sorry I didn't write anything down. It was kind of like all over the place, but I haven't had any time to write anything down. She's sleeping right now. I'll try to show you. We'll see if you can see her in there, but it's kind of dark, so I don't know if you'll be able to see. So come with me. Oh, this is our little sleeper. She sleeps in this like so well most of the time. And this is a swing I got from a friend. It's the Fisher-Price Papasan cradle swing. We just got it yesterday, so I'm not sure how much she likes it yet, but hopefully she'll like it. And this is her sleeping on her belly, snoozing away. Yep. She is alive. I know you're not supposed to put them to sleep on their belly, but she likes to be on her belly for her naps. Otherwise, if I put her on her back, she just wakes right back up. But I put her on her belly for her naps, and then I go in there every once in a while, I tickle her feet, and I make sure she's still breathing. And she turns her head really well and holds her head up really well already by herself, so she just turns her head to the other side while she's sleeping. So that's good. Alright, I guess that's it for this video. So sorry it took me so long to do it, but things have been so hectic here. And I have no time to do anything. But hopefully I'll be able to make some more videos. Excuse me. Some more videos soon. And if anyone has any suggestions for what kind of videos you want to see, then let me know. Alright guys, thanks for watching and subscribing, of course, and commenting and all that stuff. And I'll see you next time. Bye.